Welcome, Abigail, to the Femsplainers.
Thank you. It's great to be here. Thanks so much for having me on.
Well, we're a little nervous because your book has barely been published and there's already great controversy surrounding it.
Yes, Amazon has refused to allow sponsored ads for my book. So if you do a search, if you enter search terms on Amazon looking for my book, you will find sponsored products, some of which are books promoting and encouraging girls to medically transition to the opposite sex, or at least looking like the opposite sex. But if you try to publish a book like mine, which is skeptical that that's a very good idea, apparently that's enough to get you blocked from sponsored ads.
Well, before we get into all the controversy, let's talk about, and let's be very clear, I think we need a disclaimer up the top of this interview because it's so easy to have everything taken out of context and the important things that you are saying taken out of context. So let's clarify who and what we're talking about and who we're not talking about.
So the book is about a sudden spike in transgender identification among teenage girls. These are girls who claim to have gender dysphoria, which is the severe discomfort in one's biological sex. That's the sort of psychological underpinning to the transgender identification, which is sort of the social designation. But what's interesting is these girls what they have does not look like typical gender dysphoria at all. So it really has no bearing on the individuals who are afflicted with genuine gender dysphoria and are now many of whom are now transgender adults leading good lives. And I interviewed them for my book as well. This is a separate phenomenon. It's a pure contagion that seems to be spreading through teenage girls in friend groups.
How big is this phenomenon? Like, what are we talking about? Because you say this isn't actually people with sort of, can we say genuine gender dysphoria, or
Sure.
the percentage of the population? You've noticed this as a real trend among adolescent girls.
Right, it's enormous. So it's throughout the West, Canada, Scandinavia, the US, and the UK. And in the UK, they know that it's up over 4,000% among adolescent girls. In the US, we know that it's way up. We know that 2% of high school students, for instance, now identify as transgender, whereas it used to be 0.01% of the population. So 1/100th of a percent of the population. It's a massive increase. The reason we don't know what the percentage is precisely for girls that has risen in the US is because you no longer need even a diagnosis of gender dysphoria in order to get the hormone therapy. So a lot of girls are just getting it without even any diagnosis.
Wow, that's incredible. And I just wanted to underline what you just said previously. Amazon, of course, is the largest distributor of books in the world. And Jeff Bezos is on track to potentially be the first trillionaire in history.
Wow.
And Amazon is censoring speech. It is censoring a book deeply reported by a former Wall Street Journal staff writer, now a frequent contributor, that they will not take those sponsored ads when it's the biggest book distributor in the world. That shows you the state that we're living in, what the state is doing to us. So I think that is unbelievable. And the next question I wanted to ask, which is out of order, but I'll ask it. I suddenly became aware of all this with the Brown study, and I never knew what happened to that study, but you unpacked it and it was shocking. Can you share about that?
Sure. So Lisa Littman is the researcher, a public health researcher, and I interviewed her many times. And she noticed while she was, she was at Brown University, and she was scrolling through her social media feed, and she noticed that a huge number of girls, many more than the prevalence data she would have expected, were coming out as transgender just in her social media feed, and that they seemed to be clustered in friend groups. And that really surprised her. This is an ailment. We have a 100-year diagnostic history of gender dysphoria at this point. So we know what it looks like. We know what real gender dysphoria is. And it's always afflicted males overwhelmingly. There were some females, but it was overwhelmingly male. And it starts most often in early childhood, ages 2 to 4. little boys who insist they're not boys, they're girls. They don't want to be a boy. They don't want to play with boys. They don't want to play with boy things, that sort of thing. And all of a sudden, out of nowhere, the predominant demographic now all across the West is teenage girls with no childhood history of gender dysphoria. So she knew it didn't look like normal gender dysphoria. And she also knew that this demographic was special in this way. And that is, it was susceptible to all kinds of hysterias or peer contagions. So this is the same demographic that experiences anorexia, bulimia, cutting, and so forth. And she hypothesized that this might be one more peer contagion.
Well, it's something, as you've written, that has just suddenly happened. That suddenly it is like a contagion, as you call it, and it's something that, as you reported, it thrives in imitation in your peer group. That if somebody does it, you're much more likely to do it than if not. Is that correct?
Yes, that's right. I mean, she found that, in friend groups, it's over 70 times the expected prevalence rate. That's even if you accounting for the fact that you might say, oh, kids might be more comfortable coming out as transgender today. The social stigmas have fallen away. Even given that, it's a surprising number. It's very high. And we're seeing this across the West. Yeah.
And what you said, which was so fascinating, I just noted this down. You sort of hinted it at the beginning. It said, the transitioning, this whole idea to transition to a boy, is not necessarily related to sex or sexual preference. It's not, I mean, in some cases it might be because you have nascent feelings as a lesbian, but it's sort of now being channeled that way. But it's not even a medical diagnosis. You said it's a social identity that they are taking on. And there is really no more, there's nothing more to being transgendered by this definition than just saying, I'm a boy.
Right. So it's not even necessarily about gender, is the funny thing. These girls are in distress. We know that. We've seen that. Jonathan Haidt has written on this. These girls are in the midst of the worst mental health crisis we've ever seen among teenage girls, with very high rates of anxiety, depression, and they, people who study this link this to the emergence of the iPhone and social media for these girls. It causes them a severe amount of distress. So these are girls that are very, very, they're definitely in very real pain, and they sort of look to the culture as people in psychological distress do, to be able to self-diagnose. What is the pain that I'm feeling? And because there's so much awareness and prevalence of the transgender identity in the culture, they're looking to gender dysphoria to explain the pain they feel. And of course, there's also all the influencers on social media.
What about the parents? Is there a typical parental response when they hear about this, or who are these parents of these girls?
So these are white middle class and upper middle class girls by and large. The parents are very educated. They're very supportive. They're Gen X parents, and they're politically progressive overwhelmingly. And I think the reason is because they have a certain open-mindedness to it, which is not a bad thing. When they're first presented with it, rather than saying, when a child says to them, I think I might be a boy, or they often start out with, I think I might be a lesbian, the parent doesn't say, no, you're not, or you're only 12, or that's terrible, or anything like that. They embrace the child. They say, that's wonderful, that's totally fine with me, I love you anyway, all the stuff. And sometimes what the young teen was looking for was not exactly support for her genuine sexual identity. In some cases, the child was just asking for rebellion. She was really asking for a space to separate from mom and dad. And when she doesn't get that, sometimes then she turns to the transgender identity, because that gets mom's attention.
Well, it also gets cultural attention, right? You talked about these influencers. Like, just tell us a little bit about how it's the thing. If you're having these questions and maybe you're wondering if this is what I should do, what happens to that young girl?
So this was a part that really disturbed me when I interviewed teens who had gone through this. There's so much celebration of these identities on social media. And so they're on, Reddit or Tumblr or whatever it is, TikTok. And, a lonely, anxious teen, girl of 12, 13, 14 will decide that she might be transgender too. And there's a lot of encouragement for this online. And if she selects a transgender identity, and I've heard this from adolescents, they will get flooded with congratulations and support, and you're so brave, and all what they call a love bombing, in a sense, by all sorts of strangers. Some of them, many of them adults, and some of them up to no good. And it escalates sometimes from there.
It's confusing because one of the most wonderful things about our era, something in high school I never thought I'd see, is gay kids being accepted from such an early age, and kids having such an understanding that being gay or being bisexual, that these are things that don't hold you back socially, that are, the kid who was, 30 years ago, 50 years ago, have been really taunted by if she came out as lesbian or a boy came out as gay. There's this wonderful
especially
acceptance.
in these communities, right, Caitlin, that
I
Abigail's
guess
talking
I've always
about.
lived in those communities.
Yeah,
Yes,
but
you're right.
It's the woke, not woke parents, but the
Right.
accepting, affluent parents who are in many cases liberal or left, and this is exactly what you say. They would be, some would be even overjoyed to find out that their children
Right.
are
But so
gay.
what I just want to make the point that
Sorry.
we want to obviously affirm and accept these gay kids 100%, and we'll get to in a second what do we do for girls who truly are trans. But there's just this sense that something has whipped through the culture that I used to think of as benign. Like I would see these girls and I would just say, good for them. I was a kid in the 60s and 70s, your identity, you're creating it. It's all about this. And as a former teacher, I would always say to parents, listen, if you want, not gender issues, but just if you want to fight with your kid for 3 months about how his hair is cut and what he's wearing, you go ahead. But you might as well teach him about like something like about history or religion, because at least that would be worthwhile. So reading your book made me realize that I myself had bought into a way of response that was irresponsible as a community member. Can you kind of walk us through the things that happen to a girl when she has affirming parents and she gets affirming care at her pediatrician and affirming care everywhere she goes? What happens?
Sure. So it tends to solidify the identity in the child's mind, in the young teen's mind. So one thing to know about today's Gen Z, so the generation born starting in the year 2000, is that they're awfully young. They're very, very emotionally young. They have been really tended by helicopter and snowplow parents, right? And they're very good students often. And they don't drive. They don't smoke. They don't do they don't even go to the mall by themselves anymore. So they don't do any of the things that sort of maybe foolish, but help you grow up a little bit and test your limits. So when they come to their parents with one of these identities, and this the other thing, they have much less sex than the previous generation.
Like almost zero.
Almost zero,
Yeah.
right. So they don't even kiss. So when a girl comes and says, I think I'm lesbian, the parents who are liberal very, very often embrace it and take it really seriously. But in fact, oftentimes the girl actually has no idea what she is. She's never kissed anybody. And what she was really asking for was the opportunity to be her own person. And anyway, sorry, that wasn't exactly your answer.
No, but that's you're right. But then that's the sort of trendy way now to do it. And what you wrote about, and this was the thing I found so distressing is, as Caitlin says, your daughter comes to you, and this would be most, parental reactions, parents of this kind reaction. Okay, John, if that's what you want to be,
right.
You do that. And then they are then thrust into this, not just the embrace of the influencers, but the school guidance counselors, everyone leaps aboard that this, and then you can say, okay, well, that's great too, except that it starts taking them down a road. And this was the sort of frightening aspect, especially if you're a parent, that this child who, I mean, even, you know, the 30 is the new 20 and 50 is the new 40. I mean, even adults are immature today. You're taking a 12, 13, 14-year-old kid, and suddenly you're the mother. You're going, okay, John, you're in an office. She's getting prescribed testosterone, puberty blockers. Talk about the sort of quick slope to real physical intervention in this, not just
Right.
psychological, but physical.
Okay, so it starts at the schools. The schools will affirm and keep it from the parents. So if the child
Yeah, if the
decides after
parents
getting
disagree, right.
right, so even they will get the gender indoctrination very often in the school system. And I looked into California to show exactly what's going on there, and it's a model for the country, really. And so they'll get the in gender indoctrination in the school of, oh, look at all the options for you. So the kid picks one and even comes up with a new name and pronouns. And this is all kept from the parents. They will start using an opposite sex bathroom and stay with the boys on the overnight trip and whatnot. And the parents have no idea that the kid's called Jim for a year or whatever.
Mm-hmm.
But then they are very much encouraged. Look, if you're transgender, prove it. I mean, that is the next step, right? Mm-hmm. So in order to establish, no, you really are different. You're the real deal. There's a big push to medicalize, and unfortunately, these come with not only very serious physical consequences, but the girls who go through this process do not end up very often any happier because they didn't have genuine gender dysphoria or typical gender dysphoria to begin with. If these girls were just transitioning and they were living productive, happy, healthy lives, I wouldn't have written this book because I don't really care in that case. But the truth is they're not. They're very often just as miserable. They cut off their families. They're permanently infertile, and they are certainly no happier.
Let's roll back because this was the real revelation of your book. Because if it's just, we'll call you Jack, fine. But it's not that. It starts with real medical treatments. And as you point out, you don't have to get these treatments. You don't have to do much more than just say to a therapist or a doctor, I'm a boy. And then they teach you to sort of on this online community, you have to say you felt it all your life. And even if you haven't, and then they start doing the breast binding, which reminded me of Chinese foot binding, right. Ancient Chinese foot binding, which none of us would think is a great idea, but they start wrapping their chests to hide their breasts and their developing breasts. And then they start getting very serious chemicals, hormones put into their bodies. So testosterone, the puberty blocker, what is it, Lupron? Talk about what those things actually do to you. And we're talking about 13, 14, 15-year-old girls.
So puberty blockers start before puberty. So that shuts down part of the pituitary that stimulates puberty. So those are slightly younger kids that would go on to that. So usually ages 8 to 11. The girls that I really look at are the teenagers, and they very often start with testosterone. And the really insidious thing about testosterone is it sort of, in some ways, it does amazing things to cure normal female adolescence. So it reduces anxiety, it redistributes fat, it sometimes even can control depression, and it gives you a boost of confidence and euphoria. So these
those
girls,
young men are so confident and
right. It gives them that swagger, and they can't wait to tell their friends how great they feel. The problems, of course, is that it can lead to infertility. There's often, doctors will recommend a prophylactic hysterectomy if you've been on it for 5 years because of the risk of endometrial cancer. It gives you body hair and facial hair that never goes away. It alters your features. It deepens your voice in a way that doesn't seem to go away. And it alters your private anatomy in ways that are a little disturbing.
This is just information that is being blocked from the public. And there's an agenda here. And for this book, that not to be allowed to advertise it on Amazon is part of the agenda. And when there's an agenda that says parents should not know the consequences of prescription medications that they may not even have been told their kid is taking, when there's a whole agenda to keep the parent away from this information, then something evil is happening, because your parent is the person who'll be with you forever. And the notion that, you know, this whole thing, as you said in the book so wisely, that there's this notion that, oh, if your parents don't agree, don't worry, your parents know nothing, your parents are fools, they're hateful people, only we know. And a kid can ride high on that, but your online community, that's not the one who's going to help you in life. You know, your parents are the ones who care about you and know you. And I found that desperately sad, and it made me hugely angry.
Well, you pointed out when you referred earlier to California, you wrote it that the June 2019 California Teachers Association voted to allow 12-year-old girls and up to seek hormone treatment without parents' permission. So these potentially, and you know, look at the controversy that surrounds a menopausal hormone replacement therapy, all the possible effects, the higher rates of cancer. These are not things that you play with, and let alone puberty blockers that stop natural development. There's, as you point out, there hasn't been enough time to research the long-term effects of what happens when you do that to your body. I mean, we
That's
know,
right.
for example, that when you don't breastfeed, I mean, you know, if you can, it's the best thing you can do for your baby. But it's also a very good thing for you, because women who breastfeed have lower incidence of breast and ovarian cancer. So we don't even know the health repercussions. But I think the thing that I just almost, I couldn't stop reading. I was reading it and I noticed that I had chewed all the nails down on my left hand, was the double mastectomies, called, what do you call it? Something very benign, like top surgery.
Top surgery, yeah.
Some of these girls are seeking at 16. They're having their breath. Talk about that.
Right. So one of the disturbing things is activists have been able to to persuade medical professional organizations to change their standards with regard to this area of medicine specifically, so that it's the only area of medicine I know of where the doctors are relying on the patient's self-diagnosis. So a girl will come in and say, I'm gender dysphoric, I've always been that way. And based on her self-assessment, a medical clinic, sometimes not even a doctor, it may just be Planned Parenthood, makes her sign, you know, a waiver of the risks. She, on an informed consent basis, it's called, and she gets a testosterone that day. And it's the same thing with top surgery. She doesn't even need a therapist note saying that she really does have gender dysphoria. And sort of the proof, in some sense, the proof of how out of control this has gotten is that so-called non-binary girls show up asking for double mastectomies and get them. So non-binary is someone who insists they're neither gender. Well, if you said that the rationale was gender dysphoria and it was to achieve, you know, I'm really transgender, I'm only comfortable as a boy, maybe you could understand that rationale. But doctors are removing healthy breasts for a girl who wants to look more like a neither male nor female.
My sense before reading it, and I'm still a bit confused, is that there were a lot of girls on the hormones, but that this surgery in the high school phase was rare. But so how many girls are getting this kind of surgery?
Oh, it's a good question. I don't know the numbers of surgery. I know that it I think quadrupled between 2016 and 2017 for biological females. So we know that these surgeries have gotten massively popular. The hormones is usually where they start, and the age of medical consent varies by state. In Oregon, it's 15, but in most states, you have to wait till you're 18 to get the cross-sex hormones. Unless parents consent. So these girls are starting testosterone sort of as soon as they get 18, and they spend the years before that dreaming and obsessing over testosterone.
You know, I wanted to talk, just read one quick paragraph about I really think there's something evil in these activists who are going into schools and getting, you know, we're both in California. The California public schools are always in the lead of things like this. That it is already the case that you can opt out of sex ed if you don't want your kid, for whatever reasons, religious beliefs, or you just think those are things that should be taught at home, you can opt out. But you cannot opt out from this 13-year gender indoctrination, which starts with the kindergarten teacher telling you that your gender is a guess that your parents made the day you were born. That's an evil thing to say. And imagine being in a kindergarten and saying, oh, mom always told me I was a boy, but she just guessed that because I had a penis. So I'm confused now.
There's something very insidious going on, because so the parents there was a massive protest of this when they found out, you know, what was in some of the gender curriculum. And the California came out with its new framework. It's called the Framework for its Educational System. And parents got very upset about that very thing. There was a book in it that I think was called Who Am I? I don't know, I quote it in the book. And it and they demanded it be taken out. And so that particular book was taken out for kindergartners. And then but then they supplied it to teachers via the virtual libraries. So it's still a resource provided to the teachers by the public schools, even though they officially took it out of the curriculum. This is the kind of games that they play with parents, and they're very good at it.
Well, again, I want to go back to the disclaimer, because I remember, you know, in the 90s, there were big conversations about Heather has two mommies, and they're already promoting gay marriage at a, you know, at the kindergarten level. And, you know, and I don't think you're saying that. And I want to clarify, I don't think this is the same thing. That, first of all, bringing sexuality to kindergartners, I think, is just silly either way. Like, why do they need to start thinking about any of this? But that what this leads to in terms of self-harm eventually, and what is it in the and Caitlin, you've written so eloquently about girlhood. What is it? I mean, it seizes this certain demographic of girls in their teenagehood. I mean, a lot of kids who get that same talk in kindergarten are not going to go on to do this, but it does seem to seize the same girls who might have been cutting, the same girls who might have been bulimic, and yet this seems so harmful. Why do these girls feel this hatred or dislike, or feel so detached from their bodies that they feel they have to go this far?
Should I chip in? Okay.
Yeah.
If I were introduced to sexuality at probably age 10 and 12 and 14 through internet porn, which is, you know, you might be doing everything in your house to make sure that doesn't happen. The second they're at a play date, big brother knows how to do. The big brother in the household has taught the younger. And so they are seeing, the average American 12-year-old has seen more extremely hardcore pornography than the entire fighting forces of the Second World War. I mean, this didn't exist. It's extreme that a kid can plug up a very extreme niche kind of kink, which, you know, more power to people with kinks. But that a kid will be seeing that, I think as a girl, I would have turned away from sex. And
that's right.
Very afraid of sex. Because
that's right. They find it terrifying. Yeah.
It is terrifying. Sometimes I watch it and I just think, this is terrifying to a girl. And the ones who, and in, you know, you can find the ones where the women are empowered or they're, you know, the dominatrix, but in most of them, women are just really being treated like objects, and very harshly and very roughly. And so back to what you're saying, Danielle, girlhood, it's always been this delicate, difficult passage, always. And in the 90s, we were all dealing with it from the perspective of some very flawed research by Carol Gilligan, which ended up being
oh my God, I remember
reviving
that.
Ophelia. But that really that had some truth to it, which was that girls were being forced too quickly into sexuality, was her main thesis, let alone the kind of world they lived in. And that she didn't think a 12-year-old, this book was written 25 years ago, 12-year-olds, the most they should be doing is holding hands, she said. And she's super progressive, who wrote this. What's her name? Mary Pfeiffer. So she's sensible. And since she's written that, we have had all this pornography, number one. Number two, we've had a brand of feminism that was meant to empower. That was the original thought, but really made it ultimately like, God, it is horrible to be born female. There's all this date rape. You're constantly going to be sexually harassed at work. You're going to, you can never, in college, the minute you get there, you'll have your first rape and you'll be raped until the day you leave. It is like, get me out of this identity as quickly as possible because it's a dangerous identity. Is any of that kind of adding into what you're finding? Either the
Absolutely. That's all part of it. I mean, they get so many messages that it's terrible to be a girl, that it's terrible to be a woman. You're just a victim. And at the same time, in addition, you mentioned the violent porn, that's a big part of it. But part of it is just seeing beautiful women torn apart on social media. I mean, I was interviewing one adolescent who had gone through this, and a young woman, she's no longer an adolescent, but I trans-identified and was on hormones and whatnot. And I said to her, she said, well, there aren't any positive female role models. And I said to her, what are you talking about? I just saw, help me understand this. I just saw A Star Is Born with Lady Gaga. She's not perfect looking and she's a heck of a role model and whatnot. And she said to me, don't you know how they talk about her online?
Oh my God.
I realized what I thought was a very positive and not perfectly, perfect looking role model for women. They saw her online because that's where they exist. And to them, women like that get torn apart. And so that means, of course, they get torn apart.
Who is their ideal? Who did you discover was the sort of person that these young women are admiring?
That's interesting. I don't know that they had a woman that they were admiring because all of their, if you look at the Kardashians or whatnot, they feel that every perfect looking woman is someone they can never, equal. And of course they can't, because it would take all kinds of surgery and airbrushing and whatever to achieve that. And also they're in the middle of adolescence, the most awkward time.
That's the historical part of it. And this is that great, discomfort and that when your body takes over and yet you feel emotionally not ready and physically not ready to have sexual relations, that you start. And I think, Caitlin, historically women sort of want to hide. I mean, unless you're being married off in a culture that marries you off at 14, and you did the analogy to Sleeping Beauty and Snow White, that these maybe were fairy tales about cutting out for a few years. If only I could go to sleep and wake up as an 18-year-old and, oh, there's my handsome prince, all good. I didn't have to go through what is increasingly becoming a very confusing and difficult, especially, as you say, with the constant pelting of online images. Not that there weren't images all through the ages, including, in cinema and magazines.
Right. And it's, hello? Are you?
Yep, I'm here.
Okay. Just to go back to what you said before, it's very different from being gay. I mean, I want to emphasize how different this is from an announcement of being gay. A child who comes to their parent or a teenager and says, I'm gay, is asking the parent to accept them for what they are. A child that comes to them, a teenager that says, I think I'm a boy, is asking the parent to accept them for what they are not. And the psychological,
or certainly not certain about at that point. Yeah,
well, certainly not
physically or not. Right, biologically you are not.
Right. So what they have to go through in order to even present in a convincing way is extremely risky. It is, not at all certain to cure their whatever distress they're going through. And it may not even be real gender dysphoria that they're suffering from. So, the outcomes for these girls are not great.
I need you to tell us, because this is just so
Yeah.
terrifying. This is where I really lost all my fingernails, where you actually went through, you described what happens. And this is obviously not everyone is doing this, but when you decide to go the full, I want to call it the full Monty, but I don't think that's right. You've had your double mastectomy. Now you want a penis, not happiness, a penis. What, well, that too, I guess. Tell us about the surgery, because it's being done. It's an incredibly, forget about the emotional side, complicated medically, and is being done by people who aren't necessarily, just describe what you have to do. And the forearm part, just, oh my
Right.
God.
So, I interviewed a lot of transgender adults for the book, and, one of the things I care about and they care about is transgender health. And unfortunately, this has so captivated the medical profession, and these are such big money makers that they often don't have the best doctors working on it. So I talked to one extremely highly trained microsurgeon at a very top hospital in the country, and he's a plastic surgeon and has microsurgery fellowships and whatnot. And he will not do the bottom surgery, which is creating the neophallus from desleeving the forearm and transferring arteries and veins and whatnot. And he won't do it because he says, I became a doctor to cure people, not to do that. He doesn't feel comfortable doing it. But what bothers him so much is because he won't do the surgery, it is this highly experimental surgery is performed by people he considers completely unqualified because the hospitals make so much money from them. It requires, a neophallus requires several surgeries in order to get it to stiffen, to penetrate.
The forearm thing was crazy.
Yeah.
I didn't know.
So yeah, they desleeve the forearm. They take basically a roll of skin and fat and nerve and artery. They have to transplant it to the crotch area. And the difficult thing is they have to get a urine stream through, and they have to get it to stream, not spray, which is very difficult. It really is very susceptible to blood clotting. So and the sutures you need are apparently like a quarter of the size of a human hair. This is a very, very difficult microsurgery under the best of circumstances. And then, of course, there's another surgery you need in order to get it to stiffen, and in order to get it to stiffen enough to penetrate is even more difficult. Now, fortunately, most girls at this point are not seeking phalloplasty, and part of the reason they're not is because they're not really trying to be men at all. They just want to stop being girls during a time in adolescence when nobody wants to be a girl.
Yeah, it fits in what you were talking about, Danielle, that kind of ancient, carving of skin. Always it's more prevalent in girls. It's a mortification of the flesh, trying to cut the flesh, damage the flesh, get out of the flesh, and you can't do it. Of course, you're still there. But I just want to add into this conversation, just my own point of view, but obviously, if a kid comes to parent and says, I'm gay, first place, I always tell parents, that's a high compliment to you in your relationship, that your child feels safe enough to tell you that. And what you need to do is you don't make a huge deal out of it. They just want to know, am I the same person to you that I was before? And you go, oh, okay, glad you told me that. And you keep on making dinner. And they're like, oh, my mom is still my mom. This hasn't changed my relationship. And so I think because we all know that so well, we assume, well, if a teen daughter comes in and says, I'm a boy, we're supposed to go, oh, that's good. Okay. And then she starts in her teenage girl way, because they're so relentless on anything. They're relentless about getting a new pair of earrings. They just won't let it go. And it comes up over and over. And the parent thinks, well, good parenting of a gay child is, of course, to accept. Mm-hmm. But is good parenting to a kid who comes forward with no previous sign at all of gender dysphoria, is it good parenting to just say, that's interesting? Or should you say, why do you think that? Or should you say, no, you're not. You're actually a girl. Let's look at some pictures. Like, what is the right response of a loving parent?
It's a good question. It is really different. So there are of course there are kids who have gender dysphoria, and there are even girls who will want to become a transgender adult. These people exist. I would never deny that. Okay. But when a girl, the questions to sort of wonder about was this girl, did she have gender dysphoria as a small child? And you would know it's a severe, consistent, insistent discomfort in a biological sex. It's very severe. Okay. So did she have that? Has she been, subject to all these internet influences? Is this the influence of her peers? Does her peer group have a lot of kids who are suddenly identifying as transgender? And has she been subject to this gender ideology in her school? And those are things that never affected transgender adults, right? Nobody I know who I interviewed as a transgender adult, none of them did it because of YouTube. But these girls will often say, I discovered I was trans because of you. They will tell you that. So I definitely think that I've talked to a lot of psychologists about this, and the ones that I have sort of the most trust in and respect for will say to me, you don't have to agree with their self-assessment, and you don't have to go along with it. Okay, just because she says she has gender dysphoria and she's a boy now, and please call me Tim or whatever, you don't have to go along with it. You can support her and be loving without buying into something that you don't think is right for her, and you don't even think is authentic.
I think Caitlin's really right, though, because your impulse, and this is where when you got into the hormone blockers, that your impulse as a parent, and certainly this would be my first impulse, is say, okay, this will pass, or it won't, it'll get more serious. But I have no idea about what is out there in terms of the next step. And I think what was so poignant about your book is the parents you were just so accepting of it, and you want them to be happy. And again, it's a very affluent problem because suddenly you're going to therapists and hormone clinics and things. But you don't understand that the next phase, and as your child obsessively gets into it amongst these YouTubers and online, that the next thing she is going to want to do is have these puberty blockers, and that's serious. And the next thing she's going to want to have is testosterone. And if it keeps up, you get down the road to the double mastectomy. But you quoted Dr. Blanchard from my hometown of Toronto, CAMH as we know it, who was head of the gender dysphoria unit. I mean, this is a very, very serious facility. It's a preeminent mental health facility. He was there for years and he got fired. Tell us what happened.
So I talked to both Ray Blanchard and Ken Zucker. Right. Ken Zucker was the one fired. Ray ended up retiring. Both brilliant men. And Zucker, who was fired, actually chaired the committee that wrote the entry for the DSM on gender dysphoria. And he was fired for allegedly having violated the conversion therapy laws, which we have in America, in many states as well, which say that a mental health professional cannot perform conversion therapy on the basis of sexual orientation. And that's, a good thing. Obviously, conversion therapy was often very grisly and involved all kinds of terrible practices, but they inserted gender identity laws in language into these laws so that you couldn't help a child anymore get comfortable in their biological sex. Well, that's literally the treatment that had existed for decades, and that's what Ken Zucker had pioneered. And it wasn't converting the child, it was helping them get more comfortable. And very often what Dr. Zucker found was the problem, even though the child had latched onto gender, the problem that was causing the distress often had nothing to do with gender at all. So in many cases, a child would dress as a girl to get his mother's love and attention, but not necessarily because, he was sort of irrevocably gender dysphoric.
That is so interesting. And it's just taking me back to my teaching days where, parents would come in and say, I'm really worried about my daughter or son. They're tanking their classes. They used to be a good student and they're not doing well. And I don't know if she's got a learning disability or whatever. And you kind of have to quietly say, well, what's going on at home? You know, there's a monstrous divorce that's going on, and this kid is barely clinging on. You sometimes have to talk to the parents. A lot of times the behaviors that most disturb parents have nothing to do with the behavior. It has to do with some deeper-ish psychological issue. And if you don't get to that, they're going to keep focusing on the behavior. And I just think it's cowardice that's led these doctors to do this, because a huge number of them, of pediatricians, huge number of them think this is wrong, this wholesale, affirmative care for these kids, but they are frightened of being canceled within the medical community. Well, it's just very tiny, real well, that's what I want to ask you. What about your parent, your daughter? You knew from the get-go that maybe she's a lesbian, maybe she's trans, but from the beginning, she has a gender identity and it's not female, and she comes to you and says she's a boy. Now what do you think is the best practice for the parent?
So I think that's a very different situation. So if a child, you've seen this kid, you know that she has severe discomfort. By the way, that's not the same as being a young lesbian, okay? So girls, very often women who are lesbian and describe their girlhood, they describe tremendous discomfort with feminine type things. That's not gender dysphoria necessarily. That's not a persistent and severe discomfort in their sex. That's just a more tomboyish presentation. And we used to allow that, right? We used to say girlhood and womanhood was this, giant room that allowed for all kinds of expression. And today we say, oh, you must really be a boy. So
right, a tomboy was a way to do this without, while remaining a girl.
That's right. A lot of the lesbians I talk to think that this is basically a euthanizing of young lesbians, and with good reason. Many of these girls would end up as lesbians probably if they were just sort of left alone to experience womanhood and sexuality in whatever way it evolved.
Didn't you have that? Didn't you find that if most were not left alone in the sense that you didn't do anything about it, but that if they didn't start doing the hormone blockers and things, that 70% or something you had that would just either just nothing would happen to them and then a certain percentage would be gay? Is that, can you?
Right. So gender dysphoria, so it's been around for a long time. And one of the things we know about it at this point was that most kids have outgrown it. So even little boys who are terribly uncomfortable being boys, most of them will just emerge as gay men. There's no intervention required for them. They're fine. They go on to live healthy lives as gay men. Today, because of sort of the politics and activism behind it and the new approach, which is to immediately agree with the child's self-diagnosis and get them on hormones immediately. And all doctors are willing to go along with this. And it really, takes a problem that, in many cases would have just dissipated over time, and it solidifies it.
Before you go, because I realize we're running out of time, I just wanted to go back to one thing about Dr. Blanchard, who said that psychiatric patients should not be their own doctors. And this idea that a patient comes and tells you, I am, a trans, and his method was to explore. And he would often find out, well, as you said, no, well, maybe you're trans, but you also have had a very difficult relationship with your mother. Let's explore that. And often the other issues would go away. But this is also feeding into a little bit of the politics of misogyny. You talked about the erasure of lesbians. We've talked about why is it so bad to be a girl. You noted in the book that we don't allow anyone to appropriate except when it comes to sex. What is this saying about femininity and womanhood today?
Well, there's something very disturbing because, just today somebody wrote to me and said, I'd love to have you on my podcast, but I can't. This is too controversial. And the disturbing thing about that to me is that the activists driving this shutting down of this conversation, many of them are biological men. Some of them are genuinely, gender dysphoric and transgender. This should have nothing to do with them. And also, they should have nothing to say about whether girls in distress get the treatment they need, and that we're all allowed to have an open discussion about that. It really has nothing to do with them. But activists, who are the most crazy member of any group, I mean, the transgender adults I've talked to are very lovely and sober people. They are not the activists. The activists who are shutting down this conversation are shutting down the conversation that really has nothing to do with them. And they really are sort of way over their skis on this.
Now, the most controversial aspect, and I know Katie Herzog got fired or permanently canceled for this, is the notion of regrets. If anybody has regrets about transitioning, and this is not talking about adults, but I'm talking about the girls. If they decide this wasn't right for them, did you study regret? Did they have regret?
Yeah, so I talked to a lot of girls who have regret. Unfortunately, because gender dysphoria very often wasn't their actual problem, they found that medical transition didn't solve their distress. And so we're seeing very high numbers of regret among this population specifically. The studies are just being done now because it's a new phenomenon, but I can tell you that the big, Reddit, there's a famous sort of well-known subreddit among detransitioners where they talk about their experiences. And I think 6 months ago, it had 7,000 members, and now it's up to 13,000. We know that this population is fast growing, of people who really wish the doctors hadn't encouraged them and their therapists hadn't encouraged them to make these changes they can't take back.
It's like, if you imagine having a double mastectomy at 16. I mean, that's the thing that if I was a parent, I just want to say, look, it's like with my kids and tattoos, just get through this. If you at 25, where your brain has finished forming, still want a tattoo, okay. But this is so much more drastic.
That's right. A tattoo would be, most of these parents would
like,
love
give
it
me a tattoo.
So Abigail, what's the strongest argument on the other side for affirmative care? What's the strongest argument that you found for, wonderful, you're John, and we'll go see the therapist?
It's hard because I guess the strongest argument would be, of course, you want a child to feel comfortable and supported. I mean, that's something all parents want. I think that especially, these kids are in pain, they're in distress.
Yeah.
And unfortunately, the last thing a parent wants to do is add to their daughter's pain. So they're willing to do just about anything if it pleases her. Unfortunately, in some cases, affirmation may please her, but it might not be good for her.
Right.
So there are cases in which you want to say, honey, and the problem is when you're fixating on something, right? You're just think, oh, if I just lost these 5 pounds, if I just got liposuction, I know my life would be better if I just had that nose job or whatever it is. And the problem is we're always convinced when we're teenagers that the thing that we've decided is causing our distress is going to be the cure-all. And that's why we don't usually in other instances, we don't let teenagers decide what life-altering decisions they want to make.
One of in the fairy tale vein, I was thinking all through this, especially with the surgeries, of the real Little Mermaid tale by Hans Christian Andersen. And unlike the Disney one, the mermaid doesn't just lose her voice.
No.
She gets feet at the cost of every step being like knives. Right. And of course it's a very tragic ending, but I feel like that as you say, they start to almost fetishize or obsess over losing their breasts or, taking these hormones and getting facial hair without understanding the deal that you are making, that these are not going to, it's your body. These are things, and in these cases cannot be undone. You said that actually the most successful parents just pulled their kids out of these environments. One went to a horse farm. Another family just moved to the rural, to get them out of this peer group.
Right, because all the experiences of girlhood that we remember, you know, sitting in a girl's room for hours or at the mall and talking or writing in your diary and working through these experiences or giving your friends a hug, they don't do it anywhere near as often, okay? So they just sit on the internet of steeping in this transgender sort of this, you know, feedback loop of gender ideology, and it doesn't fill them up. So the next question is always, what am I going to do next?
Yeah.
Well, I would really challenge, I don't even want to say it in a confrontational way. I would encourage or invite podcast hosts, people who look into issues like this, who write about books, to turn to your book and have you on and have a conversation. And the host may not be convinced, even a debate, but even just, you know, to say, I really disagreed with this. What were you thinking here? That's how we get, the way we as a civil society advance is that one person has one idea, the other has the other, we throw them on all on the table and we work to figure it out as best we can. And to say that, oh, this is a topic that's very much protecting girls' physical health, we won't advertise on Amazon. I mean, Jeff Bezos has a lot to answer for in terms of suppressing speech. Yeah. No wonder he wants to have a monopoly. He wants to suppress speech. It's all in a continuum.
It's funny because some people say to me, well, so what? So they're still selling your book. They, you know, so what that they don't sponsor an ad? And my response is, well, what about when they decide to stop selling the book at all?
That's next.
I mean, it could be, right? There are no books. I mean,
not for your book, but, you know, a year down the line, the next book, you know, this is blocking freedom of expression. It's blocking scientific inquiry. It's blocking parents getting the full picture before they make decisions. It's an agenda, and it's not your kid's best interest that the agenda has at heart.
And I think you so shrewdly pointed out, Abigail, that imagine if the whole school curriculum was trying to persuade your children not to have vaccines. And, you know, we know there are a lot of anti-vaxxers out there. And, you know, and then you as a parent find out that your child is being, you know, brainwashed not to have vaccines. It's a similar type of harm that is coming to these kids by taking these hormones, often without their parents' knowledge. But we would all, you know, most people would get behind not having that kind of curriculum. So it just has such repercussions that go beyond just mere acceptance and, you know, encouragement and being a loving parent to your child. It's an important book that you've written, and I agree with
really
Caitlin.
Important.
I hope
really
it.
Thank you.
Probably the most important book of the year. Nobody has written this book. Yeah. No one has researched it. No one has had the courage. Your courage is to be commended. The courage to come forward, knowing it would be hard, knowing that you would be identified as somebody who's transphobic, knowing all of this, you performed an act of service to parents and to girls that they are desperately needed. And I think this book is going to do a lot of good.
So it's going to help a lot of parents and girls. So Abigail, the book is Irreversible Damage, The Transgender Craze, Seducing Our Daughters. Thank you so much.
Thank you. It was terrific to talk to you. Thank you.